First, let me be clear. Conventional medicine is incredible. It saves lives. If I'm in a car accident or I have a heart attack, that's exactly where I want to be, in a hospital with skilled doctors and nurses with life-saving interventions. But here's where it gets complicated. When it comes to chronic conditions, the things you've been dealing with for months or years, conventional medicine often focuses on managing your symptoms rather than asking the bigger question, why is this happening? You're tired all the time. Here's a medication. Blood pressure is high. Here's another pill. Thyroid's not working. Let's replace the hormone. But nobody's asking what's actually causing this. This is where functional medicine is fundamentally different. We're not just asking what medication treats these symptoms. We're asking what's broken and how do we fix it? Think of it this way. If your check engine light comes on in your car, you don't just put tape over it, right? You look under the hood to see what's actually wrong. That's functional medicine. Conventional medicine often treats the check engine light. Functional medicine opens the hood. We spend time with you, really listening to your experience. When did your symptoms start? What else is happening in your life? What does your diet look like? How's your stress level, your sleep, your gut health? Because all of these things are connected. And here's what most people don't realize. So many chronic conditions that you've been told you'll have for life can actually improve or resolve when you find the root cause. Let me give you some examples. Hashimoto's thyroiditis. It's an autoimmune condition where your immune system attacks your thyroid gland. Conventionally, you get thyroid hormone replacement and you're told you'll be on it forever. And sometimes the medication is necessary, but here's what's often completely missed. It's an autoimmune condition. So why is your immune system attacking your own thyroid gland? In functional medicine, we investigate. Is there gut dysfunction? Because 70% of your immune system is in your gut. Are there nutrient deficiencies, such as selenium and vitamin D3? Are there food sensitivities triggering inflammation? Is there chronic stress dysregulating your immune response? When you address the root causes with a personalized plan, many patients see their antibodies decrease. These symptoms improve, and they can even reduce or eliminate the need for medication over time under supervision. Or take high blood pressure. You get put on blood pressure medication, which again, sometimes necessary, but nobody's investigating why your blood pressure is high in the first place. Is it insulin resistance, chronic inflammation, mineral deficiencies such as magnesium or potassium, poor sleep causing stress and hormone imbalances, life stress, hidden food sensitivities? Are there chronic infections such as tick-borne disease or EBV mono? When we identify and treat the actual cause, your body can regulate blood pressure naturally. I've seen it happen over and over again. In functional medicine, we run comprehensive testing. And I'm not talking about just your standard panel that you get done on your annual physical. We look at complete hormone picture, gut microbiome, nutrient levels, inflammatory markers, food sensitivities, toxic exposure, genetic factors, the whole picture. Because here's the truth, what's causing your Hashimoto's might be completely different from what's causing someone else's. What's driving your high blood pressure might be totally different from the next person. That's why cookie cutter, one-size-fits-all treatments don't work for chronic conditions. The real issues, the ones actually making you sick, often go completely undiagnosed and misdiagnosed in conventional settings. But when we catch the root cause and address it with a targeted nutrition, lifestyle modifications, supplementations, and sometimes, yes, medications when needed, your body has the ability to heal and recover. Now, I want to be really clear. I'm not telling you to stop your medications. I'm not saying conventional doctors don't care. Many of them are doing their absolute best that they can within a system that gives them less than 10 minutes per patient and limits what they can investigate. What I am saying is you deserve more. Find someone who takes the time to understand your complete story, not just your symptoms. Know why this is happening and not just a prescription of what to take. Whether you work with me at Renew Integrative Health or you find another functional medicine provider, and there are amazing ones out there, make sure they're asking the right questions. Make sure they're looking for root causes, not just managing symptoms. Make sure they see you as a whole person and not just a diagnosis. I'm Andrea Dean, a functional medicine provider specializing in women's health and hormones. I work with patients throughout the United States via telemedicine, so no matter where you are, you can get to the root cause you deserve. Link in my bio for a free preliminary consultation